Hello, my name is Chad Timmermans, and what I want to talk to you about is a model of how we approach therapy at the Timmermans Method Clinic. So most families come in here and they say, we want our child to be able to do this function. The goal we have is this. We want our child to sit, we want our child to stand or walk or roll over or be able to lift their head up, control their trunk, be able to use their hands for feeding, whatever it may be. All movement-based, movement-orientated. And so what we do is we say, okay, and so I'm just going to use sitting, for instance, right? So we use sitting. So little Johnny wants to be able to learn how to sit. His parents say if Johnny can sit, it's going to make, it'll open the world to him and make our lives a lot easier. Brilliant. Now, most families come to us after having done therapy elsewhere previously. And what they say is that the therapist tries to elicit a voluntary motor action. Now, eliciting a voluntary motor action means they try and help Johnny sit up. Or they put Johnny on the floor and they put some pillows around him. Or they do stuff to go, come on Johnny, come on, you can do it, come on, you can. And they're trying to literally get Johnny to do it. Now, that's great when it works, but it doesn't always work. And I tend to see the kids that doesn't work for. So we go, okay, let's elicit voluntary motor action, not happening. One of the things is this, you can see I know, you don't have to say it, I should have been an artist. This is my iceberg, okay? And most therapists will treat what they can see, which is what is above the water. You can see that. Let's just get him to do it. But what are the different components that make up sitting? Well, you've got body awareness. You might have core strength. Now, so body awareness, I know where my body is, core strength, I can switch on and I can use this. But also with sitting, there's also other stuff there's also tactility. Tactility is I can feel the ground, I can feel my body. Some children with special needs can't feel properly. Proprioception. Proprioception is knowledge of where my body is in space. It's not just awareness of your body, but also where is it? Where am I? Okay. There's also vestibular. Vestibular function is how well your inner ear functions. Can it sense where you are in space? Then after vestibular, there's also your ability to respond to that vestibular stimulation, which is balance. Now, strongly associated with your ability to balance is vision. Now, a lot of the kids that we see, whether they have genetic conditions, cerebral palsy, developmental delay, wherever the different things may be, different disorders, often their vision is affected as well, whether it be their ability to coordinate their eyes or their ability to be able to make out detail. So either we work with that or we refer for that as well. Vision issues. You might have, after all this, then you've got strength. You might have issues to do with endurance. You might have issues for what we call motor planning. Motor planning is, I'm going to do this, or in order to do this, I need to do this. Your ability to be able to put different elements of movement in together in a sequence to be able to plan it out. Okay? So we've got body awareness, core strength, tactility, proprioception, vestibular function, balance and vision, strength, endurance, motor planning, and there's others as well. Okay? Oh, there's reflex. Reflex or early childhood reflex integration. Okay, and the list goes on, but that's the majority of them. Now, what becomes interesting is this. What do you think the child will benefit from more? Trying to elicit a voluntary motor action? Come on, Johnny, you can do it. Come on, you can go. Come on. Or where's the toy? Or go, okay, why can't Johnny sit? What's missing for him? Does he have poor body awareness? Does he have poor core strength? Does he have inability to be able to balance, or can't feel his body? Does he have motor planning issues? What are the different things that he's lacking or missing? Instead of trying to get him to sit, which is getting to sit while he's missing elements, instead of that, how about we go back and fill in the gaps, fill in the elements that he's missing. As a result of that, when he comes to learn how to sit, if all of this stuff is improved, all right, then there's a chance that sitting might take care of itself. You might not have to do the sitting therapy because all of a sudden the recipe's correct and the cake will rise. But there's a second benefit to this, that if you can improve all the different stuff that's below the water, and the reason we use the iceberg model is it's easy to see what's above the water, but what's below the water is the majority of it. If you can improve all these different elements, all of a sudden, Johnny doesn't improve just his sitting. He improves his hand-eye coordination, his use of his hands. He improves his ability to be able to communicate with the world, know himself in relation to the world and the world around him. He's not only sitting, but now he's rolling, maybe even crawling. As a result of that, he's starting to participate with other, and it goes on and on and on. Improving all these things that are below the watermark, below the line, it's like a weed. All of a sudden, you're focusing on one thing, but then all these other areas of Johnny's function are improving as well. So, at Timmerman's Method therapy clinics, in order to work on sitting, we go back and work on all the stuff that Johnny's missing so that when we come to it, either eliciting the voluntary motor response will be a lot more effective, or we won't need to do that at all. This is how we approach all of the issues with children, whether it be sitting or walking or standing or balancing or whatever the different function that the parent brings for us to work on. That's the approach that we take. Thank you very much.